Kaiser Permanente is bracing for what may be the largest healthcare strike in U.S. history, one that stands to have an outsized impact on patients in California, and the Bay Area in particular. Here's what to know about the 3-day walkout set to start Wednesday and last through 6 a.m. Saturday unless a labor deal's hammered out in time to stop it. What's it about? Post-pandemic burnout and pervasive short staffing in the healthcare industry, where workers say they care for too many patients for too little pay, have galvanized unions throughout the country to demand higher pay and better working conditions. The looming Kaiser strike, which comes just days after the last contract expired, culminates about 6 months of negotiations and deals with many of the same issues that fueled other walkouts in the industry earlier this year: starting salaries, raises, benefits, hiring practices, and workforce development. 8 labor groups under the aegis of the coalition of Kaiser Permanente unions say the healthcare giant reported more than $24 billion in profits over the last 5 years, paid its CEO more than $16 million in 2021, and gave 49 other executives more than $1 million a year salaries. Read more. Google, Kaiser pitch in to help San Francisco meet APEC summit fundraising goal. Meanwhile, labor organizers say Kaiser wants to cut performance bonuses for support staff and outsource jobs to low-wage, for-profit companies, while letting wages lag amid soaring inflation. Kaiser calls many of the coalition's claims misleading, saying it offered across-the-board wage hikes and a company-wide minimum hourly pay of $21, $5 less than the union's desired $26. Kaiser officials also say they spent millions to train staff, accelerate hiring, and fund pay bumps of 10% and 14% over 4 years. In a statement over the weekend, the union coalition said both sides remain far apart on key issues like pay and staffing. So far, there is no light at the end of the tunnel, union leaders wrote. In the days to follow, however, Kaiser executives downplayed the imminence of the walkout. A strike is not inevitable, hospital officials said in a statement, and it is certainly not justified. Even so, thousands of temp workers have been hired to fill vacancies just in case. How big of a deal is it? Pretty big. Some 75,000 workers in 8 states say they'll take to the picket lines for 3 days if Wednesday comes and goes without a new labor contract. And though the Oakland-founded nonprofit hospital chain serves 13 million patients nationwide, a disproportionate share live in California, the unions bracing to strike represent about 19,000 Kaiser workers in the Bay Area alone. Meanwhile, 2 other unions with a combined 14,000 members who work as engineers, scientists, or managers have authorized a sympathy strike. Picket lines are planned for more than a dozen Bay Area Kaiser locations, including in San Francisco, Oakland, San Leandro, South San Francisco, San Jose, Hayward, Santa Clara, San Mateo, Vallejo, Richmond, Fremont, Antioch, Santa Rosa, Walnut Creek, and Redwood City. Who's striking? Let's start with who's not joining the walkout: doctors, nurses, and managers. Emergency departments and hospitals will remain open, according to Kaiser spokespeople, as will pharmacies for inpatient care and critical infusion services. Our facilities will be staffed by our physicians, trained and experienced managers and staff, hospital officials reassured the Standard in an email Tuesday, and in some cases, we will augment with licensed and contract staff. Read more. Nurses raise alarm on unsafe conditions at a top SF hospital. But the unions threatening to strike represent members who provide critical service to patients. They include tens of thousands of support and other staff say they're ready for the picket line, including X-ray and lab techs, phlebotomists, workers who disinfect rooms between patients, pharmacy employees who dispense medications, home health aides, therapists, transporters, housekeepers, ultrasound sonographers, vocational nurses, and a range of others who help with surgeries, run imaging technology, and work in outpatient clinics. How will it affect patients? Though a strike as massive as this one would be significantly disruptive, studies have shown that walkouts are unlikely to harm patients. The 3-day work stoppage at Kaiser, if it happens, will spur a flurry of rescheduling, but only for non-urgent appointments and procedures, and only as long as that is appropriate and safe for the patient, company officials said. We will contact any patient affected by the strike in advance, if necessary, and work with them to reschedule their appointments, Kaiser officials told the Standard. There is no need for patients to call or email their doctor's office at this time. Should a strike occur, officials said some outpatient pharmacies will close or reduce hours. If possible, patients should use Kaiser's mail order delivery option to refill medications in 3 to 5 days with no shipping fee. Lab, radiology, and optical locations may also temporarily shutter for the duration of a strike, per the hospital. For urgent needs at any of those sites, members can call 866-454-8855. Though that call center may be inundated with longer than usual wait times, hospital spokespeople say it will be staffed around the clock. In addition to reaching out to individual patients as needed, the hospital is directing members to look for the latest updates at kp.org. Of course, there's still time to stave off a walkout. While a strike threat is disappointing, it does not necessarily mean a strike will happen, Kaiser officials added. We are continuing to bargain in earnest. We take any threat to disrupt care for our members seriously and have plans in place to ensure we can continue to provide high-quality care should a strike actually occur this week. Will it delay COVID booster and flu shots? Rolling out COVID boosters this year has already been slow going, and a strike certainly won't help. In addition to Kaiser only receiving its supply of COVID vaccines a couple of weeks ago, union members say chronic understaffing at the hospital chain has compounded delays for people trying to get inoculated before cold season sets in. According to media reports, other pharmacies are preparing to take on patients who may be unable to get their vaccines through Kaiser. The nonprofit health giant says it still plans to offer the shots on a walk-in basis at some locations even if there is a strike. It just might take longer to get one.